Public health is really about ensuring that every resident has the opportunity to live their healthiest life. But on a day-to-day basis, public health gives guidance to empower people and organizations serving people to make the right decisions around their priorities, where they're putting their funding, who they're serving. It's not dictated.
In the Berks County Medical Society, this is at the very fabric of who we are. We're a 200-year-old organization that was founded on coordination of health services. I think 200 years ago, first doctors were riding horses into Reading to talk about smallpox, from Hamburg down to Morgantown, where that is, where it's the coordination, what the doctors need to do. There are no hospitals, there is no other care except the family doctors. At its core, that's what we've been striving to do up till COVID. If you really think about it, all that we do, it's really about how we help community health and how physicians can join together and make our county a healthier place.
I thought it was amazing to see a community come together and say, we really need to think about the next chapter in how we manage public health.
What we saw today from our presenters, it is all about collaboration, coordination, and connections so that we can influence the greater county, all of our residents here. But in education, we're focused in on the 70,000 students and making sure that they have access to great public health. Very encouraged by the 4 recommendations and hearing more today and understanding how we move forward with the next chapter with the coordination and collaboration to implement what our county commissioners see as best as we go into the new year.
Sometimes when you have a topic like this, you worry if people are going to come in with a certain prejudice or an agenda. I didn't sense that. Rather, what I heard were people sharing from their arena of expertise. And I think that is extremely valuable. I think more importantly, when you look at the study was designed to look at our needs, our health needs in Berks County. It did a great job, and this presentation today, I think, did an excellent methodology of presenting that.
When people get together and are coming for a common goal, I believe, is that's when lives are saved. You know, when people put other aspects into it, we get off the track of what's really important, and that's saving lives. I'm very encouraged by this, to see all of the aspects come together in one group, to be presented to all of these medical officials, to show the county that this is needed.
It really encouraged this morning, like you said, by the diversity of people that was here. If you come into a room with people of the same thought, don't waste your time, because they're all going to bring the same ideas. They're all going to want to move in the same direction. When you want to look at what should be done in a community or what the best way to move forward is, you need to bring in people with different thoughts. You need to bring in people with different backgrounds, and then you come together to say, okay, how do we move forward for the betterment of the community that we're serving?
I do think it's possible to work together because, again, the facts are the facts. You can interpret it how you want, but at the end of the day, the percent of patients in Berks County with diabetes is what it is. It's hard data. At the local level, it's not about politics, it's about what's right for you and what's right for the community, which transcends politics. And it seems like we all want the same end goal, the same result. So I feel like we're so much closer today than we were 5 years ago, and certainly 10 years ago here in Berks County, towards our hopeful goal of having a Department of Health.